First of all, I'll just introduce myself. I think you all know me, Charlene Pyskoty, Bernalillo County Commissioner, District 5. And I just want to thank you all for being here today. I thought about what I wanted to say, and you'll be hearing a lot about our behavioral health initiative. But I want to take some time just to thank you for all the work that you do. And, you know, as a mental health therapist myself, I know the great need for behavioral health services. And I want you to know just how deeply this goes. And the work that you do impacts everything, right? And let me just tell you a little bit about my morning. Right before I came here today, I got a referral from an employee assistance program. As a therapist, I get referrals, and today I got a referral for a crisis incident because somebody had attempted suicide at a place of business yesterday, and they were looking for a therapist who could come and do some crisis counseling today. And so it's a store in my district. And you know, what I think I really want to convey is how much behavioral health issues affect all of us and how there's so many different pieces to the puzzle. And you know, people here who are doing environmental work, you don't know how that impacts behavioral health, but you know, I want to kind of tell you a little bit about that. People who are working on economic issues, other health issues, criminal justice issues. As a therapist, I work with a lot of people who are college students, high school students, college students, people in their 20s. It seems like most clients nowadays are in their 20s. And what I'm hearing is that they look at the world and they don't have a lot of hope because they look at climate change and they think, why should I bother if they're predicting that the world's going to end in 30 years? They're saddled down with college debt that they feel like they're never going to be able to get out from under. And, you know, just other things, finding housing, things like that, just make it so difficult, especially for young people today. And I know that you're all doing really good stuff for young people. And I want you to know that the work that you do in every area picks us all up, and your work makes the difference between mental wellness and depression, anxiety, trauma, violence, homelessness, substance abuse. These are all behavioral health issues that your work, you know, can help lay the foundation for better behavioral health in our community. So I'm going to turn this over to Commissioner, Madam Chair, Maggie Hart Stebbins, and she's going to give you a little bit of the history of the Bernalillo County Behavioral Health Initiative. She has been with it from the very beginning, and I want to hear a little about the history and especially about her passion, why she saw this as such an important area to focus on. So, Madam Chair.
Well, thank you. I want to thank all of you for being here, and I apologize that we are on this side of the dais and you are over there. I wish it were a little bit less formal, but really glad to be here. And I want to start by saying just what a pleasure it is, what a privilege it is to have Commissioner Pyskoty on the County Commission, because, you know, those of us who have been there from the start, none of us actually had any background in behavioral health. And so having somebody who really is a practitioner, who understands all of the facets of the behavioral health system has just been amazing. So just can't say how thrilled I am that you are now part of our team. So I have been on the County Commission for 10 years now. My engagement in the behavioral health process has really been through my exposure to how we run our jail. My focus has been on the criminal justice side of county operations and quickly recognizing the impact that substance abuse disorders and mental illness have on our jail population and the individuals in our community who get involved in the criminal justice system. And I think by saying that, I want to make it clear that not everybody who lives with a behavioral health issue ends up in the criminal justice system, but I know on a regular basis it is as high as 50% of people who are in our jail who are getting some kind of psychiatric services or some kind of behavioral health services at our jail. And because of the McClendon litigation, we have the best behavioral health services in the state. We're the biggest behavioral health provider, but individuals who are in our jail have much better access to behavioral health services than anybody who is out in the community. And so that's great. We really want individuals who are in our charge to get the services they need to get healthy and not recidivate. But we also recognize that the reason they come to us is because they're not getting what they need in the community. So that has been part of the genesis of the Behavioral Health Initiative here at the county. We had a period of time that I'm sure you all remember when we had in the city of Albuquerque a number of very tragic interactions between law enforcement and people living with mental health issues. And I think that raised the public awareness of what it means, what it costs the community if we don't provide services in the appropriate way. And so in 2014, on the 2014 general election ballot, we put a question asking voters if they would support the implementation of a new behavioral health, a new gross receipts tax. We had one of the hold harmless increments that we hadn't used, and we asked voters, would you support a 1 cent gross receipts tax that is dedicated to expanding access to behavioral health services? And we had it, and the results were overwhelming. Close to 70% of voters said yes across, and that was consistent across the county, whether it's, rural, urban, across party affiliation, across income levels. The understanding of the need for these services was pretty consistent. And so in 2015, we passed the tax. The 5 county commissioners at the time, we actually had to make an affirmative vote to do that. So we've been collecting the tax since 2015, and I think one thing I want to say is, number one, thank you for being here. I know all of you, and I can say that the work we've done has been very much in line with what you're doing at the legislature, and I feel like we have always had great support from the legislature. Senator Ortiz-Pino, all of you have been real champions for this. And I think at the governor's level, not so much, and at the city of Albuquerque, not so much until recently. But now I feel with this new governor and with the support in the legislature, we have the opportunity to do some really productive partnerships that we have not had the opportunity to do before. So it's been great reaching out to the different cabinet secretaries who have a role in this and beginning to explore how we can finally have partnerships with people at the state level. So Katrina can talk with you about what we're doing, like what we have done. I think we're collecting, it started about $19 million a year, $18 to $19 million a year. It's now up to about 21, 22. And so Katrina can talk with you, can tell you like what we've done, where we hope to go in the future, and what we hope to get from the legislature and from the state of New Mexico, because there are still a few obstacles. $22 million sounds like a lot of money, and it is a lot of money, but it is not enough to address all of the needs. And so as we move towards filling the gaps in the continuum of care, there is a very significant role for the state. So I'm just so pleased that you're here, and look forward to working with you. And I want to recognize, I'm sure you all know her, but our county manager, Julie Morg-Spaka, just joined us, and her chief of staff, Clay Campbell. So they obviously have had a very important role in making this all come together. So with that, I'll turn it over to Katrina.
Good morning, and again, thank you for being here. It's really important for us to not only describe what we're doing, but how we sort of evolved and what the purpose of the tax was. As Commissioner Hart Stebbins stated, the tax was implemented to create a safety net service, but it was also implemented to fund things that are not otherwise funded. And so when we started taking a look at what we could do, we could not do things that would supplement Medicaid. That was not the intent or purpose. It was to really build off of something that was already created in order to implement new safety net services. So when we start looking at this, I get a lot of questions from legislators quite a bit. Well, why don't you just help fund more of the same service that is just funded by Medicaid or another third-party payer? And the answer is we need to build the network and not just add to these compartmental components to try to create a system. So I hope that helps. But what we're here to talk about today is a little bit of the history on how we got started. Not only did the tax get passed, but it was really important for commissioners to make sure that the community had input. So we'll talk to you about our 4 subcommittees and how things are vetted, and talk a little bit about the programs, the monies that we spent to date, what we think our next requests are from the legislature and why. And we also want to show you some of the videos that we've been working on. When we talk about behavioral health, it's huge. It's, there's so many different layers, and when we end up talking to legislators and to the community, they think of it as one answer for one problem. So you house them, you get them mental health help, and then the world is great again. And that's not the way it works. There's different levels of care and service. There's things that Medicaid does pay for. There are things that Medicaid doesn't pay for, and creating that continuum is where we need to be in order to further our system. So with that, I think we'll just go on to the next slide. All right. So in 2014, the commission went out to the public and said, hey, we need a tax. Are you willing to tax yourself? And they absolutely did. About 70% of the voters said, we do. We need a system. We need a safety net system. What we had at that time were a lot of different studies that came from both the city and the county in terms of what we kind of needed in terms of crisis and different services. You had different reports from different state entities, like the J. Paul Taylor Task Force on what we needed to do for youth, but nothing that was really consolidated to really give us a fine business plan. And so we hired Community Partners, Inc. To help us develop a structure and a business plan. They went out into the community, got some input from the community, and they also looked at the different reports that we had over time to say, where do we have these holes in our system, and what do we need to do? One of the things that they had asked us to do was put together a governance structure. So when we started this whole adventure, we know that we're not just getting people from Bernalillo County that are coming to and getting help at the University of New Mexico Hospital or Presbyterian. We know that they're coming from Valencia County, Torrance. We're getting them from all over that are being centralized to get help. And so we had thought about how do you do this and how do you regionalize this and try to get some buy-in for your structure in order to actually create a safety net system for the community as a whole that's coming in to receive those services. So when we had talked about what a governance structure was really going to look like, there were 2 components that the commission wanted us to really talk about. They wanted us to look at how we get the community involved. 70% of the voters said, absolutely, we want to be taxed. And the commission said, okay, absolutely, we want meaningful input from the community. And so the other piece to that was, well, if you have a governance structure, where do we start? And so between the city and the county, we thought it was too ambitious to try to bring different entities in, like Rio Rancho and Torrance and Valencia County, in to sit at the table here, but maybe between the city and the county, if we could start aligning our efforts, that maybe then we could venture out to more of a regional approach. And so we came up with a structure based on what CPI had categorized for us in terms of problem categories that we needed to work on, which were crisis services, community supports, supportive housing, and prevention, intervention, and harm reduction. And so from there, we actually received received applications from community members with lived experience, family members, and people with, who were subject matter experts that were not going to bid on any of the projects that we were going to send out in terms of RFPs. And we started selecting these committees because the other thing that we had found out when we were going through this process is that we had a depleted workforce, and we have done business in the same way that we've always done business, which is we're going to tell you that we need this service, and we're going to tell you exactly how to provide that service to us. So, you know, if we were in landscaping, it's how to cut the grass to an inch, and the grass needs to look blue and not green, and we're very prescriptive. And in the state of where we really are today, in New Mexico, especially Bernalillo County, if you don't have the providers to provide that exact service, you don't have, you know, a complete evidence-based program, or you don't have, you know, the system as a whole to implement something that is supposed to be SAMHSA accredited or SAMHSA, ASAM accredited or rated, which are federal standards, then, you know, having a successful system becomes really hard. And so part of this process was to also change our way of doing procurement. And that means that we do something called problem-based procurement, which is we've gone out to the community and we've said, okay, we know that problems, for example, of ACEs exist. We have high ACE rates, adverse childhood experiences in the state of New Mexico, and especially in Bernalillo County. So we gave statistics out and we said, okay, so providers, you tell us how to fix this problem. You tell us what outcomes you think you'll gain, what population that you think that you'll be able to serve, and that we'll be able to make an impact in. And that's how we've started to evolve our system. The next component was making sure that that between these 4 subcommittees, that we actually had a steering committee made up the chairs and vice chairs, and that was to make sure that whatever one subcommittee was working on was not conflicting with another, and that we'd all be able to communicate on the services that we wanted to develop, implement, and provide, using the structure and the guidance from CPI in terms of their report on things that we had to work on. From there, anything that we do or propose goes to the ABCGC, which is the Albuquerque-Bernalillo County Government's Commission. And if we are funding something, then it will absolutely go to the County Commission for final approval. If the city was funding something, it goes to the City Council for final approval. So, you know, when we started looking at how to develop proposals and what CPI said we should do, so develop a crisis system, and, you know, you have to have all of these licensed independent professionals, and then you'll have teams of experts under there, and you'll go into the field and you're going to conquer the problem of crisis. When we started looking around, well, you don't have very many licensed counselors and independently licensed counselors. We don't have a billing system, and so we really had to come back, do some research, and then utilize proposals that would actually fit our community. And so we're not having the traditional approaches of a licensed independent clinician with, you know, supervising individuals who are licensed under them. We have a lot of peer models in order to make sure that we're providing the services that we need and that we're successful. Every project that we have is a pilot project because we wanted to be flexible with the dollars, and that we knew that many of the things that we were going to do were going to be a little risky because they were not the traditional model. And so from there, our proposals actually are pretty comprehensive. They have a lot of meat to them. They have a lot of statistics, and we utilize the help from the University of New Mexico Institute for Social Research. So when going and looking at the projects, you'll see a lot of projects that we have that are vetted to date, and you'll see everything that we have paid for or bought with these dollar amounts is actually in the budget here, so and approved by the committee. So you see our payroll, our behavioral health advisor. We have Hyde & Associates who advise and consult us with the next steps, what we should be implementing, and really focusing on the Medicaid and Medicaid reimbursement, what's reimbursable, what's not, what we should be enhancing with our dollars, which in turn what we should be leveraging on Medicaid dollars, and how we should develop our proposals. We also have the University of New Mexico Institute for Social Research, which we're very fortunate to have. Being at the state level for so long and being at the LFC, we got to sit and listen quite a bit to outcomes, and it's really great to get ahead of the game and be able to have the University of New Mexico help us define and shape the outcomes even before we implement the system, and then test the system to see if what we're doing is making an impact or a difference. So we have a lot of programs, and I'll highlight a few. The Resource Reentry Center, I know that some people are really interested in that piece. That was a push by Commissioner Maggie Hart Stebbins in order to, instead of dropping individuals off at the corner who were being released from jail at the corner of 4th and Roma, we actually have a building that they have to walk through. It has been designed like a gift shop at a museum where you have to go all the way through there in order to leave. And we've got case managers there. We're open 24/7. We offer them sandwiches, coffee, and a place to sit. We've got phones. The phone charger is one of the biggest things that, best things that we could have done for them. And a time for them to talk to us about what their next steps are and how we can link them into services. And so that has been very successful to date, and that's a partnership with the University of New Mexico. Another one that is very popular is our mobile crisis teams, and I think many of you have heard about that. There's a project not only in Santa Fe that utilizes mobile crisis teams, but Albuquerque does that. When we started looking at this system, we knew that here in Bernalillo County, everyone calls 911 if there is a crisis. And so we wanted to have a different model than what Santa Fe does, and we pair a clinician with an officer, and you'll see that in a few minutes. Supportive housing is another big piece to what we're doing, and again, these will be some of the asks that we come back and talk about. Because supportive housing, being able to use the behavioral health dollars on supportive housing means that we don't have to follow the HUD model. People don't have to be homeless for 364 days and stay in a shelter and prove their homelessness. They have to be homeless or precariously housed with a behavioral health issue. And so linking on not that just that supportive housing model, we've done scattered site, and now we're working on something called single site, where we're going to be able to take more intense clients in one setting and have a clinic there. It's like an apartment style, and there'll be case management there on site, as well as somebody at that front door 24/7 to greet clients and make sure that they're getting the services that they need. So these kind of highlight some of the stuff, the things that we're doing. Of course, we have actually started venturing out into a regional model. We were just asked by Santa Fe County to partner with them because there's very little resources into Harris and Edgewood. And so we were very fortunate to partner with Santa Fe County, and we're developing something called a living room model. And that is going to be in partnership with First Choice. It's going to be out in Edgewood. Commissioner Pyskoty, this is one of the things that is near and dear to her heart, and we're very excited for her to help us be on the ground floor in developing this model. But it'll be where a peer-based model where clients can come in and get services they need, not only for mental health, but we're even thinking for substance use disorders, medication-assisted treatment, and so that they don't have to come in all the way to Albuquerque in order to receive treatment. They can receive it in their own community. So, and then, what we're doing for youth is not only reduction of adverse childhood experiences, but we know that youth are homeless. And so focusing on youth and getting transitional living services that meet the needs of their behavioral health or substance use issues are big efforts that the county has really pushed. And I think at this point, it's important to see some of the work that we've actually done and the clients that we've actually affected.
I'm Katrina Hotrum Lopez, the Director of the Department of Behavioral Health Services for Bernalillo County. We administer the Behavioral Health Initiative. The following videos will give you an idea about the services that our department is creating. We are building a continuum of services that provide a variety of options to meet the behavioral health needs of our community. We're talking about people who are living with a mental health condition or addiction. Our goal is that this population, which are amongst the most vulnerable in our community, receive the critical services that they desperately need, and that they aren't unnecessarily ending up in jail or frequenting emergency rooms. Whether it's crisis services, supportive housing, or prevention, the Behavioral Health Initiative is changing lives.
Right now in our community, about 1 in 5 adults experience some kind of mental health or behavioral health crisis at least once in the past year.
No one is immune from the behavioral health issues that are affecting the community. If it's not like your close relative, it's your next door neighbor, and if it's not your next door neighbor, it's someone way down the street. But be that as it may, they're all going to affect you.
In 2014, Bernalillo County in central New Mexico set out to create and build a regional behavioral health system, one that provides services to every walk of life and every age that is living with a behavioral health condition. Bernalillo County's Behavioral Health Initiative, administered by the Department of Behavioral Health Services, has taken on this mission. They know that crisis services are some of the most urgent needs for immediate help.
Perfect example would be, let's say we had somebody threatening to jump at the overpass at Wyoming and I-40. Normally, what we do is we'd have a CIT officer respond to the scene and handle that and have somebody called out from a specialized unit. With a mobile crisis team being in the field, they could respond to the scene and be there much quicker and provide resources that only the clinician has available to them to help resolve that situation quickly and effectively.
If they need to go to the hospital, we take them to the hospital. If we need to refer them to community mental health services like St. Martin's or some other organization, we'll do that on the spot.
Lisa is part of the mobile crisis teams, a first of its kind for the county and city of Albuquerque. She's part of a 2-person team that blends clinicians from partners like St. Martin's Hope Works with police or sheriff's deputies, bringing the services right to the person in crisis.
We're usually at a client's residence or sometimes their workplace. Sometimes, they may be on the streets. So we'll visit them where they are.
For all the first responders, officers, deputies, and firefighters, having a master's level clinician respond to mental health calls created a major shift in how these calls were handled.
We're trained in first aid and medical procedures, but not necessarily in issues that pertain to mental illness. And this allows us now to know that there's an expert in that field on their way, and we can then turn a patient over to that expert. And that's something that has really become, I think, comforting for the men and women in the field to know that we can take our patient and hand them over to someone who can provide a level of care that we just aren't really equipped or adapt to do.
If we can divert from jail or even the hospital, that's the best choice.
All of the programs created through the Behavioral Health Initiative, or BHI, are data-driven. The mobile crisis teams are no exception and are generating positive results.
We would ask our dispatch center to dispatch one of the mobile crisis teams, and we would wait with the patient until one of those teams arrived. At that point, then back to the initial question, they would be able to provide, a full evaluation on the individual and perhaps prevent them from having to go to an emergency room.
Of the more than 1,000 calls the mobile crisis teams respond to annually, only 3% of the individuals they engage with actually end up going to jail.
Many people have dual diagnosis, and they have a serious mental illness. They have a serious alcohol problem. They have a serious opiate problem. They have a serious drug problem. And so the best way if we're going to have a change is we treat them collectively, treat them the same, treat them with the fact that they have a disease that we can do something about.
Which is why what we call the crisis continuum within the Behavioral Health Initiative resembles a spider web. It's, in essence, a net that ensures that no one falls through the cracks and that everyone who needs help gets it.
There is a more unified mental health community growing where people can refer to other institutions depending on ages or genders or whether there's been incarceration or whether there's children. And so there's just much more interchange in the helping communities.
Enter the Community Engagement Teams, or CETs, operated by New Mexico Hope. This first-of-its-kind program nationwide is one example of how the net works to provide stability.
I think the ability for us as community engagement teams to really engage people through peer experiences rather than through a clinician or through some sort of state entity, I think we offer much more hope.
Maria, a CET peer counselor from Shiprock, New Mexico, never expected to get into this field until someone recommended it because of her own past experiences.
Alcoholism runs deep in my family. My parents were alcoholics, and for me, that hit me the worst in my family.
New Mexico Hope accepts calls from the community as a whole, as well as referrals from other providers within the net of services, including mobile crisis teams and the New Mexico Crisis and Access Line, or NMCAL.
Connecting with the person that is reaching out for support. I let them know of my lived experiences, and that's where the connection is built. They're more open and more receptive of receiving mental health services.
I think our peers laugh at me when we first hired and started. My wife had lifesavers all over our table, and we have a jar of lifesavers, and I reminded them, you guys are changing and saving lives every day, and for many people, you're gonna save their life.
In the first year, Rocky says they've received more than 1,000 calls, and that it helps to take a team approach with the people they serve.
That's what's really cool, is that we're able to really connect with people, and it's coming from community for community, which I think is a key to that.
If you or someone you know is experiencing a behavioral health crisis, please call NMCAL. They have paid peers and professional counselors available 24/7. To learn more about the Behavioral Health Initiative, visit www.vernco.gov/DBHS.
The BHI is changing lives.
The BHI is changing lives.
The BHI is changing lives.
The next video, which is going to talk about supportive housing and some of the stuff that we're doing in our supportive housing program. It just profiles some individuals who are now have received services and support from our supportive housing programs.
Dominic Valles is studying to become an electrician, but his life wasn't always on the professional track when he was dealing with the highs and lows of drug addiction.
Serenity Mesa had a great counselor, Damien, and he explained it to me and put it into perspective really well, that when I would use that drug, it was like being held by my mother again.
Dominic's addiction started when he was 13 years old after his mother passed away.
When I lost her, it was like I lost my family.
It wasn't until he moved into Serenity Mesa Youth Recovery Center that he experienced what it was like to have a family again.
Being able to go into the kitchen and have food, or being able to have my own bed, I didn't have that for a long time.
When we created Serenity Mesa, we wanted to make it something that was all-encompassing, so something that could help a young person who was struggling with addiction issues really put the pieces of their life back together and get back on track. We watch movies on Netflix, and we do things that are normal, traditional type family stuff, so that maybe we can break the cycle and they can start with some different traditions that they haven't experienced before.
Jennifer is a banker turned behavioral health advocate after losing her 18-year-old son, Cameron, to an overdose.
He was 16 when he got addicted to painkillers after a sports-related injury, and I could not find him treatment in this state.
Today, Serenity Mesa helps young people like Dominic on their road to recovery. It is one of several supportive housing service providers under Bernalillo County's Behavioral Health Initiative, administered by the Department of Behavioral Health Services. The BHI was overwhelmingly supported by voters in 2014. The goal? To create a network of care from prevention to crisis management to supportive housing.
Housing first. If you don't have housing first, you're not going to find a job sleeping in the park. You're not going to show up at your appointments, right, without a way to get there. So without housing, none of this works.
Which is why Bernalillo County's BHI made it a priority, even creating a subcommittee focused on researching other innovative supportive housing programs across the nation.
Bernalillo County's been on this for about 3 years now, and we're about to begin to see the fruition of all that work.
And the housing services cover a vast population, individuals living with a behavioral health condition who have spent time in the criminal justice system or have experienced homelessness. It's all ages and all walks of life with a common goal of wellness and stability.
We want to see outcomes that would stabilize individuals who would otherwise be incarcerated 2, 3, 4, 6 times in a year, or stabilize individuals who go in and out of the emergency room.
Serenity Mesa is just one of the service providers. There are others with different clientele. Altogether, the BHI oversees multiple programs, all of which strive to stabilize, re-engage, and empower people living with a behavioral health condition.
I still struggle with it, but Serenity Mesa has taught me to never quit, to keep on going back, keep on seeking help. And that's probably one of the biggest things I have. I grew in a family over there.
It goes to Maslow's hierarchy of needs. They need shelter, they need a place, and they need the comfort and knowing that people are there for them.
Because of these supportive housing efforts, coupled with the multitude of other behavioral health programs, there now is help, resources, housing, and treatment available. If you or someone you know is living with a mental health condition and/or addiction, Bernalillo County's Department of Behavioral Health Services is here. Visit us online at bernco.gov/DBHS.
It's been a hard battle, but Serenity Mesa has by far set me up for a path to success.
We're changing lives.
The BHI is changing lives.
The BHI is changing lives.
The BHI is changing lives.
Thank you. So, you see sort of the impact of what we're doing now in the community, and you see how we're able to link people together with services that they need, sometimes for permanent services and sometimes for a helping hand up so people can be more independent. And that's the goal of safety net services that we're trying to provide. In terms of, we do have a little bit of extra dollars that we're looking at spending, and we've been talking about where we would actually invest this. And with the areas that we think that we'd want to invest, again, is really more in the prevention area, and then also in supportive housing. We don't have enough of either. And so looking at how we do that is pretty critical. One thing that I want to point out is that school-based health centers, when we started looking at how to get the biggest bang for our buck, especially for prevention for kids, it's really in school-based health centers. And so we're struggling at this point because not all the money is there, and because school-based health centers aren't staying open as long as we need them to stay open. And yet it's a terrific platform for us not only to help the kids in that community to get to some of those behavioral health services that are not funded through Medicaid and link them with case management, but also the components to actually link families in, because one of the most shocking things that we found was in the school-based health center study is that most kids are relating food insecurities as one of their highest priorities. And so how do we get not only the kids the food that they need, because that seems to be the easier part, but how do you get that access to families so that these kids don't have those types of food insecurities. So moving on to the next slide, we do have some legislative requests. One of the things that we didn't really talk about in terms of the crisis system and structure is what we're actually doing on the MATS campus and the partnership that we have with the University of New Mexico Hospital. And so thank you all for passing crisis triage services that allows us to get paid and reimbursed for that service. There are some challenges with that, though, and you're held at a 16-bed limit, and so partnerships with hospitals is very critical to make this happen. So our model that we want to have in Albuquerque is really a blended model where we're actually opening up units at on the MATS campus. Turquoise Lodge will be moving out by the end of June, and we actually have two of our downstairs wings that Turquoise Lodge vacated. Yes? Assessment, yes, thank you. Metropolitan Assessment and Treatment Services. And that's where we do and have done detox, social model detox there for years. And that's up to a 10-day stay based on a grant that we get from DFA. Also on that campus is about a 70-bed transitional living center where after individuals are stabilized, they can stay up there for about 6 months and get treatment, stabilize, and start reintegrating back into the community. We know that in terms of our behavioral health initiative, we needed to do more. And doing more also means opening ourselves up to more of that mental health continuum. So we're not going to necessarily be primary substance use anymore. We're diversifying and taking people who have mental health issues as well. We have been the second facility in the state of New Mexico to be licensed as a crisis triage center, so we're very proud about that, and we're hoping to open sometime in late summer, early fall. And this is, again, with a partnership with the University of New Mexico Hospital that will be providing services, medical services, right on our campus so that we can have a continuum of care. Our crisis model at the MATS campus is not to open up to the public at first, but actually to market to hospitals so that they have a referral system to step people down into. I'm not sure how many of you have seen the facilities at the University of New Mexico Hospital for psychiatric services. The building was built in about the 1950s. The layout is not conducive to what we need to do today. And so part of this whole adventure is actually asking for a rebuild of the psychiatric hospital. And along with that is that we also want them to have a 16-bed crisis triage center as well. That's linked to that. So one of our big requests is assistance with the capital outlay of the psychiatric replacement hospital that will have the CTC in it as well. Reinstate a robust case management system for Medicaid reimbursement. The reason why that is so important to us is because we know that Medicaid really can't pay for housing, but we can. So if we had that money offset on that case management piece, that means that we'd be able to unbundle dollars that we're using in case management and put them into more vouchers and single site vouchers and things that would help stabilize this community a lot more than what we're doing today. Simplify the licensure and reciprocity process for individuals that are trying to come into our state. That's been one of the biggest concerns when we've been looking at recruitment and retention issues. And so making sure that we not only look at it, but fix it this time. You know, we've got to make it easier for people to come into the state and be licensed and to transition easily into the state. Increase Medicaid rates for MAT providers. So we love medication-assisted treatment. That is one piece of the puzzle for a lot of these individuals. However, if we don't incentivize things, we'll not have enough providers that will actually provide that. And you actually want primary care providers to be looking and providing these services when they're just dealing with routine care with the clients that they serve. And that's how you get more success rates. Increase funding to expand school-based health centers. We talked a little bit about that and the reason why. Create more services for youth aging out of foster care. We have been working hard with CYFD and talking about projects like safe houses for youth who are trafficked, but we can't do it all with that. We are looking at how we do some capital and some infrastructure, but how does Medicaid go on and pay for some of those services so that we can expand our services here? Create job opportunities and incentives for formerly incarcerated individuals. Although we're doing everything that we can with the Resource Reentry Center, if we can't link people to jobs in the community, the problem is that they'll go back and try to find money elsewhere, and it's not helpful to us. Allow booking sheets to be used as sufficient IDs in obtaining state issue IDs. We have talked about case management, and we've talked about people failing as being case managers. I'm not so sure that that's the case. I don't think there have been services in the community and to allow case managers to be successful. And if you can't get an ID coming out of jail, even a state issue ID by using a booking sheet, the delay that anyone can get, services and link to services increases. And this is what we're seeing at the Resource Reentry Center and people coming out of jail. This is a simple fix that has been hard for us to try to get momentum and traction on. But I think if we do this, we're going to make a difference in a lot of lives in a quick instant. And then address food insecurities for low-income schools, and I'm not talking just about the kids. I'm talking about how to get that family there to receive the food as well. And then Medicaid reimbursement for inpatient and residential treatment for substance use disorders. That is something that has been cut out of Centennial Care, and you haven't been able to get reimbursed for that inpatient component. I know that we have been outpatient driven, but there is a need for inpatient beds that are below that medical detox beds and actually can stabilize a person for a longer period of time in an intensive treatment setting. Two things that are not on here that I'll go ahead and say that I wish for, so surprise to everyone, sorry, commissioners. But we have an issue with our 911 system. Everyone knows how to call 911. We actually started a pilot with the New Mexico Crisis and Access Line that on individuals who had behavioral health issues that were calling into the Bernalillo County 911 system. We'd actually try to transfer them to New Mexico Crisis and Access Line. In order to get that momentum, there might need to be a legislative change at a statewide level that would connect these individuals to these types of supports. Because if you look at a 911 dispatcher, they've probably had 4 to 6 hours of mental health training. You have a licensed clinician that does this full time. You're paying for this contract. So one, we would ask that there would be some legislative priority in saying that in this 911 system, we should be trying to get people behavioral health services at that very core that could start at New Mexico Crisis and Access Line. And the last thing that I'll say is forcing New Mexico Crisis and Access Line to work within the communities that would be community-based. So that would help us get our word out on the services that we implement and promote, but doing it in a very meaningful way because the state is already paying for that contract. And we think that New Mexico Crisis and Access Line is one of the best kept secrets in New Mexico. So we need to be able to promote that line, and they need to be challenged to work with communities in order to understand the resources in the communities, but also to engage in the communities so that we have meaningful, warm handoffs. So with that, that's the end of my presentation, and Commissioner.
So I thank you again, and I believe that we're going to have the slides available. We can send those to you. Also, this is being videotaped, and so we can send you a link to this. And I don't know if you know this, but Bernalillo County has its own YouTube channel. So when you wake up at like 3 in the morning and you just get on your phone, you can watch our videos on really important topics. It is whatever works for you of us. So yeah, I will send a follow-up email from this with probably other links to NMCal as well. And I have to tell you, as a mental health therapist, it used to be standard practice that we would always tell our clients and even have on our voicemail that, if this is a crisis, call 911. I have switched that to ask people to call NMCal, which it's a great service. It's staffed by licensed clinicians. They also have a texting service, which I actually tried one time because I was telling clients about it, and I was like, I'm just going to text and see what happens. And somebody texted me back right away, so it's a great service. Jerry?
We used to have the nurse hotline for physical health.
Yeah.
And then the 3 HMO, or in those days 4 HMOs, all said, oh no, we want to do our own, so then we wound up with 4 hotlines. And there was a whole issue of how do you get the information back and forth. Do you all transfer from the MCO's individual hotlines to NMCal? Because that would be another link up that we ought to try to figure out how to do.
Oh, yeah, that's a good idea.
They have clinicians. I think they may have nurses too. That would necessarily be a
Yeah, I don't believe that exists, but I think that's a great idea.
Maybe when we work on your legislation, we might broaden it to incorporate the MCOs.
Yeah, excellent, yeah. And so, yeah, I'd just like to wrap up because we do have lunch for you upstairs, but, you know, I just want to say that behavioral health dollars, I think, are the best bang for the buck because, you know, I think part of what we're doing is very cutting edge here in Bernalillo County. I think this could be a model, not just for our state, but for our country overall. What we are doing here is really good stuff, and I speak as a clinician. I am originally from Chicago where, you know, we had some pretty good integrated models for behavioral health. And I have to say that what we're doing here is great stuff. It's very cost effective, meaning it's low cost and it's effective. You know, using a lot of the peer supports is great. There's other things that we're doing that are just so creative and are reducing the burdens on those other higher cost systems like the emergency room and the criminal justice system, which, as you know, people go through there and they cycle through because those systems don't really make long-term impacts to solve the problem. And so what we're doing here is really building a system that will provide the foundation to affect long-term change and provide those long-term solutions which will reduce the money spent on those other systems so that money can go to other places. So it's a good bang for your buck, and I appreciate you all listening to this and working with this. I look forward to us all working together. Thank you.